Hello, hello. Good
Hi.
morning, good evening, good afternoon, wherever everybody is. Hello, replay viewers. Hello, Gemma.
Hey.
How are we doing today?
Not too bad, not too bad. Can't complain. Nice weather and all.
Right on. Another beautiful day here in Maryland. Um, hasn't been too bad, the weather these past couple of days, so
I think it always makes you feel better when it's nicer weather. Like certainly does for me anyway.
definitely, definitely does. I could deal without it being so hot all the time, but
Yeah,
other than
definitely.
that, uh,
Certainly like humidity here. It's so humid.
mm. So people will be coming in and replay viewers. This is also for them. Um, Today, it's been asked of me uh, several times, requested a episode on cognitive behavioral therapy or CBT. Um,
Mhm.
so this CBT, I know you're well aware of it, and
Mhm.
I have pretty decent um, background in it now. But CBT it envelops so much of what we deal with on a day-to-day basis. Um,
Yeah.
it's quite the best way to put it, as I was mentioning in the pre-live, is every episode I've done of this broadcast to up until today has in some way, shape, or form had something to do with CBT.
Mhm.
Um, so what have you or what do you know um, about CBT? Just basic stuff like off before we get into anything deep.
Yeah. Yeah. Well, I personally have had CBT a number of times, and I use it to treat many, many different like problems, anxiety, depression, many, many different things, like eating disorders. I had it for that. Um, I think certainly my experience, the quality, like the result you get depends on the quality and the knowledge of the person giving it, for sure.
Right.
Um, but yeah, it certainly treats a lot of different like issues, problems. I think, it's there's so many different things that it's supposed to help treat, that's for sure.
That's true. Everything from we've talked about triggers, your
Mhm.
fears. Basically, what they sum it all up in the words activating event.
Mm,
Um, so I mean, your ABCs of yeah, every field of anything always has its ABCs. So your ABCs of CBT is your activating event would be your A, and that's basically the trigger or the fear or the divorce, uh, whatever you're dealing with at that point in time. Hello there, Anchorman. Welcome to the broadcast. Um, so, from what I understand, the basic, just to break it down to the basics, um, the bottom line of CBT, and correct me if I'm wrong here,
mhm,
is basically to take you want to take your negative thoughts or your negative feelings, emotions, etc., and you want to reframe them, uh, try and look at them in a new light or a better light,
yeah.
and then go ahead and try and cope with it or solve it or come to terms from there. Does that sound good to you or?
Yeah, yeah. They described it to me as like trying to rewire the brain into
Mm-hmm.
not like forgetting what happened, but think of it in a different light, like you said, trying to rewire what had happened and put as much as you can a positive like spin on it.
Right. Yeah. So much of our uh, trauma therapy that I got. down at the rehab center I was at
Mm.
dealt with exactly that. It was uh, taking the bad thought, or taking what was um, my trauma, or you know my activating event, and
Mm.
just, we didn't really reframe necessarily uh, the problem itself, but the trauma therapist would drag out of me kind of my emotions based on that, and then try and reframe those. So
Yeah.
like, the long and short of it was, like, my divorce was a big trigger, or a big activating event in my life. It was the biggest trauma that I had to cope with and try and process. And
Mm.
so I think I've mentioned in earlier broadcasts that um, my thought coming out of my divorce was that I was a failure. I had failed at marriage. I failed at life.
Mm.
My three sisters are all happily married to the same person, and have kids, and I was the failure. And that's what they basically reframed. It wasn't a failure, it was just an unsuccessful marriage, and you kind of
Yeah.
look at it differently that way.
Yeah, I hear you with that. Like, I wasn't married to my ex-partner with who I had my child with, but that was like to think that I'd not succeeded with that relationship, and I was coming out of that, and meaning that my son wouldn't have his father around. That was really hard for me to deal with as well.
Yeah.
Yeah.
Hello there, Lucia.
Hey.
Welcome in. Lucia, are you guys doing a broadcast right after this today, or is that tomorrow? 'Cause we'll throw it right to her after we get done here, if that's the case.
Yeah.
Um, yeah. So in dealing with the CBT aspect, or framework, or how you're looking at things, um, at 7 p.m. Okay. Yeah, we'll be finishing up right around there, so we'll throw it over to you. Uh, but yeah, back to CBT,
Hey, then.
cognitive behavioral therapy. Um, there's a multitude of different ways to look at CBT, everything from dialectic to what's some other ones? Reprocessing, obviously, we've talked about. So I think before we really go uh, in, into too much of the cognitive behavioral therapy, we first need to understand cognitive distortions, which is why I pulled this up. I'm going to put us short screen here and
Yeah.
pull this into play. Make that number one, the big guy. Cognitive distortions. Um, these this is a big buzzword in the mental health field. And yes, Lucia, I did have cognitive behavioral therapy at the rehab center I went to.
Mhm.
Um, and welcome in Aiden. I did catch Aiden's last broadcast with the cod, the miso cod. I enjoyed that. Um, so welcome in. Yeah, so cognitive distortions, understanding those first. These are your your ways of thinking. Um, so you take, like, my divorce, uh, or your separations, or whatever, and then from there stems the cognitive distortions that move forward in life, like, because like fortune telling or jumping to conclusions is on there. Um,
Mm.
Looking at marriages, if I was to become, which I have remarried, but before I was at a place where I was ready to remarry, I was thinking all marriages are going to be the same. They're just going to end in divorce. And, that's jumping to conclusions based on what I've
Mhm.
been through. Does that make sense?
Yeah, yeah, I can totally relate with that.
And so personalization gets thrown in there as well. Emotional reasoning, that's a big one. All or nothing thinking, that's basically just saying exactly what it says. It's either everything or it's nothing at all. And that's just not a healthy way to think about it.
Mhm.
We have to give a little, take a little, um, especially in this, well, pretty much in anything in this world, you know.
Yeah, for sure.
How frequently do you see yourself running into these cognitive distortions on a day to day basis, and maybe not even realize it?
I am recently, certainly through the lockdown period and everything, it was happening quite a lot. And at first, I didn't realize. And I've had to really think to myself again, like, certainly when I realized that it was affecting my eating disorder. I had CBT for an eating disorder, and that was coming back. And I had to like focus on that and think, right, I know what's happening to me, and really try and help myself with it because I've struggled to get the help over here now, certainly with
Hmm.
everything that's going on. So I do it a lot, specifically with jumping to conclusions. I'm terrible at that. Like, I always think the worst when it comes to myself. And
Hmm.
I was in somebody's broadcast earlier, and they were on about like loving yourself and giving yourself time, and that's definitely something I don't do. I'm very patient and sympathetic with other people, but not myself.
Right.
Uh, it,
Yes. I
mm,
I guess I can put myself in that boat as well. Um, Definitely, I'm harder on myself than
yeah,
anybody else.
I think that's a really
But
common thing.
yes, it is, and these all these cognitive distortions, and there's more than just what I found here. I just found this graphic because it gets the point across, and
Mm,
it looks pretty.
yeah.
But um, yeah, there's more than just these, and the amount of times that we think, or subconsciously think in cognitive distortions, or um, you know deal with these on a day-to-day basis is staggering. That
Mm,
it happens so many times and you don't even realize it because we're so used to it. We're so used to trying to tell the fortune telling based on uh, events that have happened in the past because
oh
we
yeah.
think it's always going to be the same, which I mean that's just not the case.
Mhm,
Um, so basically, the reason that we started with these cognitive distortions is because understanding those is what is really what CBT is all about. So you want to take these cognitive distortions, which is basically like what I was telling you at the beginning with my trauma therapy, what he pulled out of me about how my divorce made me feel
mm,
were in fact these cognitive distortions. So thinking that I was a failure is a cognitive distortion. So we want to reframe that. We want to
mm,
reframe all of the cognitive distortions that we can identify in our daily thinking, and that will in turn put out a positive outlook, and we can deal with and manage the things a lot easier.
mhm.
So I mean, and then going into the grounding techniques that we learned last week, all of it tying together in cognitive behavioral therapy. So I mean, a lot to it, and we'll get into some more stuff. But I mean, what uh, what else can we say about the? I don't want to back off of the distortions just yet because I mean that is the huge part of the basics. Um,
Yeah, definitely.
uh, do we have any other examples? Maybe I'm trying to think off the top of my head of something recent. Oh,
Well,
you can go ahead.
yeah, I know with one of the biggest things for me, I was diagnosed with body dysmorphia, which is a condition that affects your way of thinking of yourself and your body. and it was a long time coming because I always saw myself as larger than I am, and no matter what weight I was, it was too much. I was too fat. I was too everything was wrong, and that was a big thing for me to realize that that's what I was doing, because I had I think it started with bulimia first and then anorexia. I ended up with both, and I was very, very poorly with it a couple of times. And to reprogram my brain into thinking that I'm still not 100% with it. I still am not a great lover of what I see when I look at myself, but I'm more accepting of it now because of the CBT that I had. I think a lot of what um, certainly my first experience of CBT wasn't brilliant, and I was like, "Well, it's not going to work for me." Um, yeah, I had to go again and get a better experience of it. But I also had it for PTSD as well.
Mm-hmm.
Um, there's so many different things that distorts your way of thinking.
Mm-hmm.
Like so many, even down to phobias and stuff. I've got a list of things here that CBT is used to help treat, and it really is endless, even down to like as a form of pain relief, which mm, some of it I can understand, some of it like in that form, but yeah, the amount of things that are on this list that CBT is used to help treat, and you can see
Mm-hmm.
why in the way of how it's to help try and reprogram the way of thinking with those things.
Right. Yeah. I do have a list as well, with
Mm,
PTSD, the triggers, yeah, everything we've gotten into already, and then some. It's a very this is going to be a multi episode um,
hmm.
subject. I feel like that's why I kind of gave it this CBT one, because I'm sure we'll be revisiting this again.
Oh
Uh,
yeah, such a vast
the,
subject.
so and also I believe that the main idea here with CBT. Now, everything I've read, and when I was doing it at the rehab center, when I was going through it, um, we we worked together as a team between myself and my counselor at the time. Um, and I have an outpatient counselor now that I still see regularly, um, that we can work on the CBT together as well. You want to work together as a team,
Hmm.
um, to kind of attack this together. So your counselor's basically the one playing the role of trying to figure out exactly how you're feeling while you're laying it out there for him, basically, and then working together to come up with a game plan on how to reframe it and move forward. But I also did read several times that CBT is also something, while it works well with a partnership between you and your counselor.
Hmm.
I think the counselor's end goal is to be able to teach you the skills to be able to do this yourself too, so that you can kind of basically handle the heavy stuff together as a team, and then the day-to-day stuff that you're gonna run into every single day we walk the planet, you can kind of brush things off, or maybe uh, reframe it real quick right there. You can
Hmm.
identify and recognize these activating events as they come. Uh, So even if it's just something minor, like you're walking, or you're at work or something, and you have a little tiff with a coworker, um, you kind of stop for a minute, recenter yourself, ground, think about it, and say to yourself, is it worth my energy to get this upset over it, or is there something we could do that will be more productive in moving past this or moving through this?
Yeah, sure.
And a lot of CBT is actually used as well with, I see it a lot in AA. Um, the 12 steps of Alcoholics Anonymous, I mean, they have you, um, Bo, no, it's not Saturday. We're actually trying to do things on Wednesday now. I think it works better for both of us, except I got held over yesterday. So we had to do it on Thursday. But anyway, Bo always distracts me. I mean, that's a cognitive distortion right there. So where was I? AA. If you look at the 12 steps of Alcoholics Anonymous, right in there, you're kind of taking you're give realizing that this has become unmanageable for you. You're turning the reins over to a higher power, and then you're taking a self inventory of all your resentments, everything, everyone you've hurt, this, that, and the other. Then you're going and you're making amends with the help of your higher power. So that's CBT in a nutshell as well. I mean, you see it pretty much everywhere in this mental health field. Uh, it's quite uh, it's an amazing thing, and I haven't by any means become a master of this, but uh, yeah, what's going on in the comments? I haven't been able to. There's Swift Beats is in the house. Welcome to the broadcast.
Hey, Swift.
Bo, we got somebody in the comments for you. They're asking you a question, I believe. So yeah, works best as a partnership, but the end goal is to be able to probably try and do these skills yourself. What do you think, Gemma? Have you been able to uh, pull
Yeah,
any of these skills in that you've?
I have, yeah. Like, certainly with the CBT, whilst you're working with your counselor, obviously it's a good if you can work together. But like you say, the end goal is to be able to go by yourself and use them going forward, because the last thing you want to do is when anything comes up is to think, I can't deal with this and have to go back to the counselor all the time. You need to be able to take those skills and put them to use with anything that may come forward. And like you said, with if you have an argument with a coworker or anyone, you want to be able to think, well, like you say, is it worth my time getting so upset about this? And rather than either flying off the handle or getting really upset about it, you want to put your energy where it's needed and not get so upset about it or argue and cause potentially even more upset in the process. It's not healthy, and you want to be able to use the skills that you've got. Certainly, I know I have used a lot of what I've picked up from um, the CBTs that I've had in the past, certainly with the eating problems, and when I split up with my partner as well.
Mm-hmm.
I'm gonna see where they're coming from, if it's mine. Yeah, it might be.
What's that?
I'm just gonna see where they're coming from.
Oh, okay.
If it's mine, are
Um,
you on Twitch or is it mine?
Oh, is that what that's Twitch?
Yeah.
Oh
If
yeah,
it's
I
my,
see the little icon now.
yeah, yeah.
Gotcha. So during the course of CBT,
Hmm.
um, some of the things that I found the list here wanted to save and go over were identifying problems more clearly, developing an awareness of automatic thoughts. So that's pretty important.
Hmm.
Um, we're developing a awareness of automatic thoughts. So to me, that means that we're trying to make this become the norm
Mm.
versus what our norm is already set to be, which is usually negative.
Yeah.
We want to be aware of that and automatically start thinking more positively. We want to learn how to challenge underlying assumptions that may be wrong, distinguish between facts and irrational thoughts. Um, that right there is cognitive distortions in a nutshell. What is
Hmm.
fact and what is irrational thought? A cognitive distortion is an irrational thought. It's the same thing.
Yeah,
Um,
yeah.
so I mean, we need to if we take a sentence like "I'm a failure," um, let's put that thought on trial. Okay, what's true and what's not true? Make the list on it and see, is this a true statement or is this an irrational thought? Um, so that was a very helpful thing I learned at the center, is learning to put your thoughts on trial. Um,
Mm.
if that makes sense. Then we
Yeah.
want to understand how past experience can affect present feelings and beliefs. We've been talking about that already as well. Our past experiences is all we know. So, uh, of course, we're going to think negatively because a lot of our past experiences are negative. These are the ones that we hold on to, at least. Um, you take a good experience and you file it away, and it's there for a rainy day when you think of it. But mainly, our negative experiences are the ones that stick with us, right?
Oh, yeah, for
So,
sure. Yeah.
of course, use understanding how our past experiences can affect our present feelings and beliefs. We're always going to be projecting this negative uh, outlook.
Mm.
We want to stop fearing the worst. Uh, we want to see a situation from a different perspective. So a lot of this is saying the same thing kind of over and over again, but it's different ways of saying the same thing, but also different ways of looking at it. So seeing things from a different perspective is how we break it down and reframe it. Um, so maybe I'm not a failure. Maybe it was just an unsuccessful such and such.
Yeah.
Um, we want to better understand other people's actions and motives, develop a more positive way of thinking and seeing, become more aware of their own mood, avoid generalizations, all or nothing thinking,
Mm.
cognitive distortions, um, establish attainable goals. This is a big one we should stop and talk about. Uh, establishing attainable goals. It's all well and good to get the basics down here and know how to identify our activating event and identify what's triggering us or what we're afraid of, etc. That's great. We're at that point. And now we're figuring out a game plan of how to, uh, reframe it and move past it or move through it. We have to set attainable goals to
Hmm.
get there. How do you feel about that?
Yeah, definitely. That's something that I struggle with, like, because of my physical health and the fact that I can't maybe do as much as I'd like, setting goals that are way above what I'd be able to do, and then getting really annoyed or upset with myself when I've not done them. It's like I know a lot of the time that I'm like putting too much on myself and the things that I expect of myself, whereas opposed to, say, if I was talking to you, say, or anyone, and I think I'd be kinder with somebody else than myself, but I expect way too much of myself and then really beat myself up about it when I haven't done it. And I deep down I know the things that I'm expecting of myself are not realistic for me, but it's trying to challenge that and think, well, no, I need to be kinder on myself. I need to know that I can't achieve that and bring the level of my expectations down of that. And I think certainly a lot of people would be guilty of doing that, expecting too much of themselves. Whereas if they were saying it to such as a friend, then they wouldn't be as, like, I guess, demanding of of their friend or a family member as they would of themselves. They put too much on themselves,
Right.
you know?
Yes, I do. So avoid we did that. Stop taking the blame for everything. I believe we are all 100% guilty of that, or at least I can speak for myself and say I like to take a lot of the blame on myself, even
Yeah.
if the other person is clearly wrong. It's basically what I did in my divorce. I
Mm,
shouldered all of that blame. Uh, a lot of it was me, but I also had to learn that it wasn't all my fault. Um, so stop taking the blame for every single thing.
mhm.
Stop falling on the sword all the time. Stop being the martyr. Um, focus
Yeah.
on how things are. Focus on how things are rather than how they think they should be or how you think they should be. Deal with what's real. Deal
Mm,
with uh, deal with things at face value and try to or stop trying to look into things and make them bigger than they are or worse than they are, because you're going to start throwing cognitive distortions there as well.
yeah.
um, Face your fears rather than avoid them. I saw this several times for CBT. Facing your fears rather than avoiding them. uh, it makes sense. We didn't go over a whole lot of this when I took the CBT classes.
Mm,
Um, we focused more on triggers and activating events, but fears are right up in there. I mean, I've mentioned it a couple of times this evening, but uh, facing your fears head on rather than running away from them or avoiding them all the time.
yeah,
And
definitely.
the last thing I had here was describe, accept, and understand rather than judge themselves or others. So yeah, we want to learn through CBT uh, how to accept ourselves and understand ourselves. If there's one thing I've preached on this show, uh, it is that education has been uh, the biggest uh, step towards dealing with it. You can't cope with anything unless you educate yourself on yourself. You got to
Yeah,
know what's up with you. And I believe you had made mention of that as well in episode 5. Your story about
yeah,
how
yeah.
you started learning more about yourself and accepting you. Uh,
I think that's what you have to do to get on the road to recovery. That's one of the biggest things you've got to do before you can get on that road to recovering.
mm-hmm.
It's yeah, one of the hardest things to do, but also one of the biggest things.
And stop judging ourselves
Yeah,
so heavily. I mean, uh, everybody's going to reach that time when they, you know, Monday morning quarterback, or they, think about something they did uh, and how they would have done it differently. The bottom line is a lot of times what you did was fine, and accepting what you did, and moving forward, and stop judging yourself so much. And you know what, if something you did does require some action, then take some action. But
Mhm.
don't just sit there and dwell on it, because you're going to drive yourself insane.
Yeah, yeah, for sure. You have to
So,
you have to realize what it is. Like, if you did something and you have to do something to change that, do that and move on from it. Otherwise, like you say, you'll just drive yourself mad.
hmm and I was seeing also CBT has uh, been used in general pain, chronic pain. Is that
Yeah,
anything you've experienced?
I have actually. I was
Yeah, I thought I heard you say.
yeah. They sent me to it was a specialist place where I had to spend, I think it was about 4 weeks. It was a good way away, so we had to. There was quite a few of us. It was like a group therapy session. It was when I'd been early 20s, and we spent about 4 weeks there going through different. It was CBT and different ways about thinking about our pain, trying to use it as a way of pain relief. I have mixed feelings on some of that because I mean, it was before my diagnosis and stuff. So I think certainly here, uh, like, it depends on, they're not as understanding here where I am of the conditions I have. Whereas certainly, like in America, it seems to be more, they have more knowledge of it over there, for
hmm
sure. Because I've joined support groups and things online and taken a great deal of advice from people in America and other places that have given me advice as to what to do to take to the doctors and get the diagnosis I need. And then when you have the diagnosis, it helps to then be able to get the CBT. So certainly the CBT that I had after the diagnosis helped more than the one I had before, because a great deal of it was more about, well, some of the pains in your head, and that was just reflecting on the doctor that was doing it more than the actual CBT treatment, which I know it can get a bit of a bad write up sometimes, but it depends on the doctor that's doing it or the therapist that's doing it.
Sure.
And I I was at first I was like, oh, it's not going to work for me. I'm not trying it again, but I am very glad I did, because if if you have a CBT session that doesn't work, it doesn't mean it's not going to work for you. It just means maybe that person that you're getting it from isn't right for you. And it
Oh,
doesn't say
sure.
anything about you. It's again, it's about the relationship you're having with the therapist. It doesn't, not everybody is right for everybody. And sometimes you need to find somebody else that you can connect with better. And then when you have that connection, then you can work on it more, I think.
Yeah.
But
Yeah. Something you just said there is a very big key factor in any uh, it, outside of CBT, but any counseling that you might go enter
mhm,
into. You have to definitely do a little shopping around to
yeah.
find the counselor that works best with you. Um,
Mhm,
I've talked with many folks that come to me nowadays and ask me for some advice on certain things like this, and I tell them, you can't get discouraged after 2 sessions with a counselor, and you're not connecting with said counselor. Just shop around and find one that, yeah, there will be one. I guarantee you, there will be one out there that
yeah.
will work with you. You know what I'm saying?
Mhm,
Yeah. With anything. Um, you got to find you're paying money basically for this service, and just like getting a car wash, uh, if they aren't washing the car to your liking, you're going to go to another facility, right?
Yeah, same with everything. You've got to find the one that's right for you. And just because one doesn't work doesn't mean all of them are not going to work. You've just got to find the one that's right for you.
Yeah, and a lot of that could also have to do with personalities. It, you might be seeing a counselor that's very well spun up on the information, but if your personalities don't mesh well together,
Hmm.
you almost kind of have to. I don't want to say you want to have a friendship with your therapist, but you almost want to almost feel like that. You know, you got to have
Yeah.
that mesh work.
It's just like people in general, you don't connect with everybody in the world. So to expect you to connect with a counselor, it's not forced to happen. Everybody in life, there's people that just do not connect and they'll just clash. And even with a counselor or a doctor or whoever, if you're not getting what you need from them, then you're going to have to move on and find the one that you do. Like with other people, like when you come across people in everyday life, if you don't get on with them, obviously with people it's easier to just like not entertain you and go away.
Yeah,
But with a counselor, especially someone that you're going to have to bare your soul to, then you want to know that you can trust them and you can work with them.
exactly. I tell people that all the time.
Yeah.
I hope it resonates because uh, too many times I hear people want to give up on therapy
Mm.
just because they're not getting along, and that puts a cognitive distortion into play. That
Yeah.
just because this therapist is bad, all of them are bad, and I'm not going to ever get anything from therapy, and it's just not true.
I've been there.
Uh, and there's so much negative thinking um, in mental health conditions like depression and anxiety, substance abuse, phobias, all this negative thinking that interlocks into those, like black and white thinking. Um, I think that was on the list of cognitive distortions, was black and white thinking. Just
Hmm.
I like to think of that, I guess, as just the plain Jane not thinking outside of the box or allowing yourself to think outside of the box.
Yeah.
Um, it's just all black and white. It is what it is kind of deal.
Yeah.
Overgeneralization, just going over the top with it with a negative. Uh,
Hmm.
Catastrophizing is even taking it a step further, and everything is a catastrophe. I mean, even if it's just some little thing at work or something, you go ahead and blow that way out of proportion.
Hmm.
Um, and always, one of the big ones. And you know what? Why don't I throw that list back up while we're talking about it again, just
Yeah.
in case. But one of the biggest ones uh, that I liked was ignoring the positive. What do they call it? Filtering out the positive. I like a negative filter. So you take an event or you take something that's happened here, and you see only the negative in it. You filter out all of the positive things
Hmm.
and focus solely on the negative. And how many times I do that is astounding.
Oh, likewise. Likewise.
Yeah. And truly all CBT, the basics at least for this episode, for the purpose of this episode, all CBT boils down to is taking these cognitive distortions here and learning how to identify them. You
Hmm.
know, because I said it earlier, um, you'll go through any given day and you'll experience a cognitive distortion probably 1,000 times and not even be aware of it.
Oh yeah.
Um, any decision you make in your day, even brushing your teeth and what have you, like, you know, has the potential to uh, give you a cognitive distortion. If you brush your teeth one day and the sink backs up, well, now the sink's going to back up every day I brush my teeth, or I brush my teeth and this happens, blah blah blah. So I just even the little stuff, it's a constant and ever present thing that we need to learn how to um, focus in on and identify. Do you have anything to add?
Yeah, it's true. Like, certainly during the lockdown for myself, things got, like, because we weren't going out and stuff as well, and the whole feeling trapped, then, like, the little things, like things that shouldn't have even been a thing, were building up and making bigger things. And I did start to get where I was catastrophizing with everything, and everything was an issue, and everything was going to go wrong. And, like, to the point where you, like, certainly for me, I was trying to hold it in so much that it wasn't until I took the rubbish out to the bin and the bag split, and it was like, oh, it's such a disaster. And I had the full on meltdown on the driveway, all because the bag split. And it really wasn't a big issue, but it was the fact that I'd let everything build up to the point where it all just, like, overflows out of my head, and it's just boom. And, like, certainly for me, I had to take a step back and realize where it went, where it started to go wrong for me, and try, if I'd have been able to step back before that happened and think, this really isn't that bad, and try and be kinder to myself as well at the same time, because I was expecting way too much of myself. And the whole being locked in, being trapped, that was just exacerbating things so much. And,
Mm-hmm.
like, because there's one thing to have it all trapped in your head, but then to be physically trapped as well, that was just really bad for me. But then I have a lot of issues around being trapped anyway, because of being in a relationship where I was physically trapped anyway.
Mm-hmm.
So that was like the triggers that we spoke about before, and I had to identify that and take a step back and try and, like, ground myself and bring it back to, no, like, this is the here and now sort of thing.
Right. And that takes us back to last week's episode. Um,
Mm,
Recentering ourselves uh, and bringing that back,
it
bringing it
really,
all back to center. Yeah.
yeah, it really is all connected.
So I wanted to add on to what we were talking about the counselors,
Mhm.
because I just thought about it. Uh, One thing that the pandemic has really done well for us is the ability to get on the Zoom platform or whatever you may
Yeah.
use for video calling or telehealth.
Mhm.
We'll just call it the telehealth field. Um, it has almost perfected that. Whereas it wasn't quite such a thing. I mean, it was a thing, but it wasn't as big as it is. COVID-19 pandemic really kicked this into high gear, and so now there's absolutely no excuse in my book, and what I tell the folks that come to me for some advice on counseling and stuff like that, um, in finding a counselor that jives with you. Uh, it is a pain in the ass, or it can be a pain in the ass to try and get an appointment. Pre-COVID, certainly. I know over here in the states, in the state of Maryland, um, you couldn't see a psychiatrist for months. You had to schedule out ahead. They were
Yeah.
so booked heavy, um, and trying to see a therapist was virtually the same. Now with the telehealth field being what it is, you literally have the option to sign on and find a therapist over in California. I mean, I could find a therapist in the UK right now. They've really done a lot of good work in the telehealth field, and it just opens
Yeah.
so many doors for you.
I think that's the way it's going to be because, like, here, obviously, like in the UK, we have the NHS. Now, the problem we have, because we have two main routes here, we have something called IAPT, and then that's like at low level mental health for like just depression. The when I was referred to IAPT at first because that was the quickest route, even though I could be waiting like over a year,
Hmm.
and they wouldn't touch me because I'd self harmed in my past. So then I was referred on to the higher level mental health um, appointments, but I couldn't get in there because I, at that time, wasn't actively seeking to end my life.
So you
Even
were
though,
in this weird
like,
purgatory.
yeah, yeah, it's like I'm not good. I'm too high risk for the first one, but I'm not high risk enough for the other one. But either way, I would have had like months, if not years, to wait for an appointment. And when I got one, like the only way I've been able to get mental health treatment is because my son has cancer and I have to go through that route of getting the counseling through the charity that does childhood cancer, which is absurd, really, when you think about it. But otherwise, I would have had to pay privately. And there is certainly a lot more out there now. But one thing that I do think's dangerous, and I don't know if you've come across this yourself, there is a website, I won't name it because obvious reasons, but there is a website out there that claims to be for mental health help. And you could go on there and sign up and say that you can help people. And depending on who you get, it could be very dangerous. And that's something that's come about. It's not a new thing. It's certainly been around for ages because I actually did try it once quite a few years back and it could be potentially dangerous. So I think people need to double check where they're going first as well when they go online. Make sure it is
Yeah,
a verified platform and that it's genuine because that also could be very dangerous. But it is brilliant that there is so much more out there now, certainly online. Um,
that is a good disclaimer.
mhm,
While the telehealth field has expanded and really taken off in a positive manner, it is good to bring up that not
yeah,
everybody is out there to help. There is still, unfortunately, the folks that are out for the quick buck or whatever.
yeah.
Yeah, our nurse Blondie says we are trained in ER, not psych. We have had to become trained as best as we can. It's a violent atmosphere, and the cops are always there because I would have been assaulted by the patients. I'm sure you have
Oh
too,
my god.
Jen. I yes. So I have been assaulted back when I was younger. Um, and times were a bit different too. You get them in the back of the ambulance, and you kind of take care of, not like assault them, but like restrain them.
Mm,
Things are much different these days, especially
yeah,
with the police brutality going on and all that stuff. So we have to be very careful. So nowadays, I don't, and I tell my rookies that I don't engage with these patients at all. If there is an issue, we back away and we let the cops handle, and they're trained to do that. We're trained to treat the patients.
yeah.
But ER nurse Blondie is absolutely right. Um, nobody in my field, nobody in the EMS field, is trained
Mm,
for these psych patients. We're trained to splint broken bones and do CPR, and get you to the hospital with a pulse.
Mhm.
Uh, we're not trained to essentially handle the cognitive behavioral therapy that we're talking about right here with the patient.
Mhm.
And neither are the nurses in the now at my hospital we have the what they call it the purple zone, that is the psych ward, if you will, um,
Mhm.
where the behavioral patients will be placed. It's the rooms with that are locked away. uh,
Yeah.
Nothing you can harm yourself with there. But really, how much are they able to do? There's one nurse usually assigned to that station. There's 5 or 6 rooms back there, and I mean, how can you? You're not getting any treatment there. You need to. These people need to be seen by trained psychologists, psychiatrists, etc.
It's sad that so many of them are ending up there now, because I know certainly years ago when even years back when I couldn't get the mental health help that I needed, and I'd taken the overdoses and self-harmed and things, that's exactly where I ended up in A&E, but it's ER, like, and that's literally where I ended up, like, obviously for the fact that I'd taken an overdose or cut myself and things, but even then, it's like there's so many people there, and when I was in the hospital not long ago in the, emergency department, the number of people that were in there because of mental health problems, and they were being physically abusive and violent, and it's scary, and it's
Yeah.
like, how has it got so bad? But, I mean, this whole COVID thing won't have helped. The number of mental health cases has gone so far up, but I think
Mm-hmm.
certainly mental health was put on the back burner for this, and now they're really, really suffering because of it, and it's the people that are on the front lines that are having to deal with it, and that shouldn't be the case.
Right. I agree. Well said. And we are about out of time this week here on the mental health hour. Let's do a quick review and wrap up like we always do. We learned the cognitive distortions, what those are, um, and basically the basics of CBT. Uh, what we're covering for this episode alone. There will be more to come on this particular topic.
Mhm.
But learning how to identify those cognitive distortions and learning um, how to see them more automatically, and living amongst them, because they're going to come all the time, um, and anything you deal with. And so we need to reshape the cognitive distortions, reframe them, try and put them in a new light, see them in a new skill, or see them in a new light, and use our skill sets to work with a counselor. Um, we didn't really mention it, but it also can be used. CBT can be paired with medicated assistive therapy, so antidepressants. For in my case, with the substance abuse, I'm on naltrexone. That's a medicated assisted therapy, um, etc.
Mhm.
So that is about the long and short of it for this week. As always, if there are any questions, you can hit us up. We've got a new ending screen now that we encourage folks and replay viewers to take a screenshot of. Um, Gemma, if you would you like to say a few words on it as you put it
Um,
together?
yeah, yeah, like, it hasn't got all the countries on, but if your country's not there, please DM me and I can add it, but it's literally just if you need some immediate help, someone to talk to, there is a list of numbers on there that you can phone and get somebody that you can talk to at any time of the day, 24/7, 7 days a week, that somebody will be there on the end of the phone. I'm guessing it will be really busy no matter where you are, so if you do need that help, I urge you to ring those numbers. However, like, I'm certainly not trained in this field. I'm only trained in my own personal experience. But you're more than welcome to contact me. My DMs are open. By all means, all the details are on the bottom.
And me as well. And please also get with us, either me or Gemma, on
Mm-hmm.
our DMs or email or any way you see fit. We're out there on all the different socials. If you'd like to come on the show and talk with us, please feel free to reach out. And
Yeah.
with that, I think we'll go ahead and wrap it up. If you're still on this broadcast, Nurse Blondie and such, please, I encourage you to hop over to Lucia's broadcast. I see they just started up. It looks like her and Veda Ashley are on live right now talking about mental health as well. I don't
Mm-hmm.
remember what topic they have. It is victim mentality. So if you want to hop over there, I'll probably be over there shortly as well. And thanks for watching, guys. Thank you again, Gemma. And
No.
we will see you next week. Go ahead and throw this up and we will call it.